All right, so in today's video, I'm gonna be showing you if you should be stretching your forearm muscles for that lateral elbow pain, or are you wasting your time? All right, welcome back to the third video of our lateral elbow pain series, where I'm taking you through one, how to tell if nerve is mimicking some of that outside elbow pain. In video 2, we went over some desensitization strategies using some cupping, some tools, your hands, all of that. And then now we are on video 3, where I'm going to be taking you through how to assess or know if your forearm muscles around the elbow are either limited in length, need to be stretched, or you need to see someone regarding some joint mobility problems. So I'm going to be going over different muscle groups when it comes to the elbow. And there's going to be one key factor that determines if it's a muscle length problem or a joint problem, and that is going to be pain location. So this is what I mean. If we're going to test these muscles right on the top side of the forearm and you're having that lateral elbow pain, we want to find out if these muscles are limited in length. And here's how you do it. You're going to bring your thumb in, make a fist, and straighten your elbow completely. So it looks like that. Then what you do is you're going to bend your wrist down. And what you see here, can your wrist get to 90 degrees or relatively close to it? And the location, what you feel, should be a stretching sensation over the front. If you feel a pinching pain or something like that underneath the wrist as you're bending it down and you don't feel that stretch on the top, you might be having a mobility problem or a joint dysfunction that may need further assessment by your clinical professionals. If not, you stretch it, you feel a stretch over here, but you get to 90 degrees, that means you're wasting your time stretching those muscles. The muscle length is normal. So maybe in that case, your problem might be something other than a flexibility problem when it comes to that muscle. So let's move on, and that's gonna be the wrist flexor muscles, which are found right here on the front side of your forearm. And we're gonna test them that same similar way. However, we're gonna turn our palm up. You're gonna grab your palm like this, wrist down to 90 degrees, and straighten out that elbow. Can you get your wrist to 90 degrees? If you can, and you feel a stretching sensation on the top side, not a pinching pain on the bottom side of your wrist, that indicates that those muscles are within normal length. Once again, it's all about stretch location or pain location. You don't want to feel a pinching pain or anything like that on the wrist. That would mean possibly a wrist joint mobility dysfunction. Go have it checked out. So now that you've learned, hey, this is normal, and this is normal, those don't need to be stretched. But if your wrist doesn't quite get to 90 degrees, maybe you're stopping at like 45 when you're stretching, but you feel a stretch right on the top side, that normal stretching sensation means you need to stretch it. You're not wasting your time stretching. So that was a lot of information just said. I want to recap so that I can simplify it and you have a good understanding of how to interpret the muscle flexibility test. You stretch like this, you get to 90, stretching sensation here, 90 degrees here, that's normal, not really needing to stretch. You have the flexibility in the muscle. But if you get to 45 degrees, you can't quite get to 90 with the wrist here, and you feel a stretching sensation here when you get to 45, that means you need a stretch. That muscle length is limited. So go ahead and stretch it, and I'll show you that in just a minute. The same principles apply for the wrist flexor muscles, which are found here. If you can only get to like 45, or you're just limited, you're not getting to that 90-degree motion with the wrist here, you feel a normal stretching sensation on the top, that means it needs to stretch. But if you feel any pain or joint dysfunction in the same direction that your wrist is bending, that means you may have a wrist dysfunction or mobility problem that needs to be assessed by your clinical professional. And stretching may not be appropriate at this time. Now that you know, hey, are you wasting your time stretching? Or, hey, I need to stretch that because I'm tight. That muscle is limited. I want to show you how to start stretching the wrist extensors and the wrist flexors. Here we go. For the wrist extensors, which is found on the top side here, just like the test, thumb inside, make a fist, hold your elbow straight, and then you're going to use your other hand to bend your wrist. And you're going to return back to neutral. Bend, feel the stretch right on the top, and return back to neutral. I like to repeat this over and over and over again, but we set a timer. Set a timer for 30 seconds, do it to your tolerance, build up from there. Typically, it's anywhere from 1 to 5 minutes worth of stretching, but honestly, it really comes down to what your body tolerates, and more importantly, what's giving you the results that you're needing. So that's how you stretch the wrist extensors. Let's flip it on over and let's stretch out the wrist flexors, which are found here. You're gonna put your hand right over your other fingers, just like this. Bend the wrist down as much as you can, straighten out the elbow. You should feel the stretch right on top of the forearm. And the same oscillation goes. Just like this. Stretch it, come back to neutral. Stretch it, and back to neutral. You should be feeling the stretch right on those forearm muscles. If you're feeling it other places in the wrist, deeper in the elbow, things like that, once again, get evaluated by a clinical professional so they can determine what's really going on for you. These are some things that we do here in the clinic to find out if we need to stretch some of those muscles or if we need to move on to another area. So now you know muscle length. Is it normal or is it impaired? Do I have a possible joint dysfunction or something that needs to be further looked at? And how to stretch those muscles if they are limited in flexibility and length. And just a quick reminder, this is not medical advice. It's for educational purposes only to show you a little bit about what we do here and also how we help people with lateral elbow pain. So a common treatment approach if you are needing to stretch some of those muscles is to do a little desensitization or massage to that area. If you need to know what to look for and how to do that, check out video number 2 of this lateral elbow pain series. It'll go over the desensitization interventions that you can try. So desensitize, then follow it up with the stretch. That's a good combination to help improve the muscle flexibility. So just remember that it does take time when it comes to flexibility. You can't get flexible like Gumby overnight. It's gonna take some time. So be consistent with it and don't be too aggressive with it. On a stretch scale of 0 to 10, 10 being a very vigorous stretch, 0 being no stretch, try being around a 3 or 4. Start there, build a routine and a consistent stretching routine, and then you can increase the intensity from there. However, remember, it's not how intensely you stretch. It's consistency, and there is a time component as well. So listen to your body. It'll let you know when enough is enough, and be consistent with it. So this is gonna conclude video number 3. So video number 4 is gonna be consisting of improving the load that your elbow muscles are able to withstand. Therefore, improving strength, endurance, reducing possible discomforts, and more importantly, giving you something that's more sustainable and long-term. So I appreciate it. If you'd hit the like, comment, share, subscribe, all of that, it does help the channel. So I hope this was helpful, helping you with movement, self-improvement, pain management, all so you can live your best active life. Take care, and I'll see you in the next video.